What happens during a heart attack and what you can do about it. Heart attacks are a serious global health concern with approximately 7 million deaths each year around the world. The disease that causes heart attacks, known as cardiovascular disease, is also the leading cause of death worldwide. While the thought of a heart attack can be scary, it's important to understand what they are, what the symptoms are, and what you can do to both prevent and respond to them. The anatomy of a heart attack. Think of your heart as a hard-working muscle that needs a constant supply of oxygen to function. This oxygen is delivered through vessels called coronary arteries. Over time, fatty deposits, also known as plaques, can build up on the walls of these arteries. These plaques can become hardened or inflamed, eventually forming blockages that restrict blood flow. A heart attack or myocardial infarction occurs when a plaque ruptures and a blood clot forms around it. This clot can completely block the artery, cutting off blood flow to the heart muscle. When this happens, the oxygen-starved heart cells begin to die within minutes. This can weaken the heart muscle, affect its rhythm, and in the worst cases, lead to sudden death. Recognizing the signs. The most well-known symptom of a heart attack is chest pain, often described as a crushing or vice-like sensation. This pain can also spread to the left arm, jaw, back, or abdomen. However, not all heart attacks look like they do in the movies. Some people may experience more subtle symptoms, such as nausea or shortness of breath. It's also important to know that symptoms can be different for some people. For example, women and the elderly may have less prominent signs, with weakness and tiredness being the main indicators. For those with diabetes, a heart attack might even be silent because the nerves that carry pain signals are affected. Taking action and getting help. If you or someone you know might be having a heart attack, the most critical thing you can do is act quickly. Call emergency medical services immediately, as they are the fastest way to get to a hospital. In the meantime, taking aspirin or nitroglycerin can help prevent the heart attack from worsening. Once at the hospital, doctors will diagnose a heart attack using an electrocardiogram, ECG, to measure your heart's electrical activity, and a blood test to check for heart muscle damage. To treat the blockage, they may perform an angioplasty, a procedure that uses a balloon to reopen the artery, often with a stent to keep it from closing again. For more serious blockages, a heart surgeon might perform a coronary artery bypass surgery, rerouting blood flow around the blockage using a vessel from another part of the body. Prevention is key. While treatments have advanced, prevention is still the most vital part of heart health. Both genetics and lifestyle play a role in your risk. The good news is that you can take control of your lifestyle to make a difference. Exercise. Doctors recommend regular exercise that includes both aerobic activity and strength training. This can significantly lower your risk of a heart attack. Diet. A heart-healthy diet is low in sugar and saturated fats, which are linked to heart disease. Focus on eating more fiber from vegetables, choosing chicken and fish over red meat, and incorporating whole grains and nuts like walnuts and almonds. Medication. Medications can also help. For example, low-dose aspirin is often prescribed for people who have already had a heart attack or are at high risk. Other drugs can help manage risk factors like high blood pressure, high cholesterol, and diabetes. Heart attacks may be common, but they don't have to be inevitable. By staying active, eating well, avoiding tobacco, and prioritizing sleep, you can help your heart continue to beat strong.